you for your question. You see, in 2020, the coronavirus pandemic and lockdowns caused an unprecedented shift from in-person care to delivering healthcare remotely. To spread the to limit the spread of infections, patients and clinicians rapidly adopted online or telephone-based diagnosis and management of hypertension. However, currently there are no global guidelines for virtual management of hypertension. This is something very new that we saw in 2020. So the purpose of this International Society of Hypertension's position paper is to provide a practical guideline on the virtual management of hypertension to improve its diagnosis and blood pressure control based on currently available evidence and international experts' opinion for adults. It is likely that virtual care of chronic diseases, including hypertension, will continue in its form in the future. Virtual care represents the provision of healthcare services at distance with communication conducted between healthcare providers, healthcare users, and their care providers. So this statement provides a consensus guideline on how to select blood pressure monitoring devices, accurate home blood pressure assessment. The Falling Walls Conference brings together the most recent breakthroughs and outstanding projects in science and society. In 2020, I was finalist in the Emerging Talents category for my research on developing a smart home ecosystem for people with heart failure. As you know, that people with heart failure are the most vulnerable people who have often very frequent hospitalization and deaths. So 1 year after discharge, it is seen that almost 1/3 of people with heart failure die, and almost half of them are readmitted to the hospitals. So this is a significant challenge that as physicians we always face, and as a researcher, I was thinking how to address this global challenge. So along with my postdoc, my PhD student and team, I have been doing a number of scoping reviews and systematic reviews of smart home technologies. I've also conducted a series of interviews with patient and healthcare providers to better understand their needs with living with heart failure. And then I also conducted qualitative interviews and a Delphi study with healthcare providers, including cardiologists, general practitioners, exercise physiologists, and allied healthcare team who provide care for people with heart failure to understand what their perceptions are, what are the barriers and facilitators of using information technologies and smart home systems. I've also been working in collaboration with my partners like the Applied Artificial Intelligence Institute, the University of Melbourne Digital Health Group to develop a prototype smart home platform that can connect with multiple devices and sensors to monitor the health of people with heart failure and how we can transfer those physiological data to a server, apply machine learning approaches to identify health problems earlier or detect them when patients are staying at home, and then provide them with alerts, behavior change messages, and also remote care to help them stay better at home. Ecosystem proves to be feasible, effective, and cost-effective. We expect that it will revolutionize healthcare for people with heart failure and provide them better support at home. It will help to reduce future hospitalizations, morbidities, and possibly deaths, early deaths that we don't expect. And the technology also has potential to support people with other chronic conditions, for example, post-myocardial infarction patients, patients with COPD, or other chronic conditions that require long-term support. This question, it was a great honor for me to receive that prestigious recognition. So you see, I'm a physician, I'm trained in cardiology, epidemiology, and digital health. And over my career as a clinician, I've seen that despite significant advances in diagnosis and treatment, the global burden of diabetes and cardiovascular disease continue to be one of the most difficult challenges in medicine. So my research aims to improve the health outcomes of people living with chronic disease like diabetes, cardiovascular disease that require long-term support and care. It's not like a infection that you go to a physician, they give you a medicine and you are cured. So these conditions require long-term support. And I mean, the traditional healthcare system has not really helped to reduce the global burden. So in my research, I'm using digital health technologies like mHealth or mobile health, wearable devices and sensors, and at the same time using machine learning approaches to better understand the complex relationships of chronic disease with lifestyle and other risk factors, develop innovative measures to early identify some of these chronic conditions and their risk factors. For example, like atrial fibrillation, hypertension, some of these conditions remain undetected and untreated for a long time and lead to complications and morbidity. But with technologies, I believe that these are some of the cardiovascular and conditions that we can early detect, provide them with proper support and intervention at an early stage, and help to reduce these burdens on hospitals and keep people healthy and improve their quality of life. So during my PhD, I showed in a randomized controlled trial for the first time in a developing country that mobile phone text messaging is an effective and cost-effective method in improving glycemic control in people with type 2 diabetes. And it might be a valuable addition to the standard of care for diabetes in low resource settings. You see, in a country like India, Bangladesh, or in many developing countries, people with diabetes, when they're diagnosed, they are not provided with adequate information that they need to follow. So sometimes a text messaging program, which is built in based on guidelines and behavior change methods, can provide them with these additional resources or reminders in an easy way for them to understand and follow and improve their health. I conducted an individual participant data meta-analysis where I pulled data from 9 studies that used text messaging for people with cardiovascular disease, and I showed that text messaging intervention can improve blood pressure and BMI modestly. It's a modest improvement, but which can be significant at a population level. On the other side, simultaneously but small impacts on multiple risk factors are likely to be clinically relevant and improve health outcomes. So you see, if an intervention using digital health can target multiple risk factors and help people to better manage them or avoid those risks, it can lead to significant health outcomes in the long term. And my current research, I'm doing some research on wearable blood pressure devices. So how a device that's worn like a Fitbit watch can measure your blood pressure over a long time, and then apply machine learning approaches to better understand what conditions are affecting the blood pressure, when to titrate the medications remotely and help people with uncontrolled blood pressure to have their blood pressure controlled, and also using smart home ecosystem as a way to provide in-home support out of a hospital setting for patients with cardiovascular disease to improve their health.